Hello, my name is Pamela Ballard and I'm Executive Director for United Way of Enid in Northwest Oklahoma. And it's my pleasure to welcome Gail Box to this segment of Community Talk. And we're going to be discussing the Picnic for Progress, which is going to take place this Saturday from 11 to 2 at Champion Park. And Gail, thank you so much for joining me today. I know that you have a great interest in the Picnic for Progress. The Austin Box Foundation is one of the major sponsors, as is United Way and the Jim Houston Memorial. So would you please give us a little background about why you're involved and what this means to you?
Okay. We have the Austin Box 12 Foundation has been hosting or helping to work with, or we've been working with Prevention Works. Drug prevention, especially prescription drug, prevention is something that is close to our hearts. My son, Austin Box, passed away about 4 years ago from a prescription drug overdose. And since then, it has been our goal to keep other families from going through the pain and the heartbreak and the guilt that our family has gone through. So by having the Picnic for Progress, there are lots of things rolled into it, but particularly we have a prescription drug take-back event, and we'll have the OBN, the Oklahoma Bureau of Narcotics, will be there, and our Enid Police Department will be represented there, and we're asking people in the community to bring any prescription drugs that they're no longer using, particularly pain medications, so that we can get them out of the hands of individuals, any individual who might be looking for those.
For those who aren't aware, we have an increasing number of young people especially, but it could be anyone who, if they have access through friends, neighbors, or parents, when prescription drugs are left in a place that's accessible, they use those, and if they don't know what they're doing, it's very, very easy for them to take an overdose accidentally, most often. And with the Picnic for Progress, they can bring these and they can be disposed of properly. If disposed of improperly through flushing them down the toilet, those get into our water treatment, and that's not the proper way to do that.
Exactly.
So,
and I always think about when we're talking about safe use, storage, and disposal, I think about, so many of us in our bathrooms, we have prescriptions that are kept in a medicine cabinet. We label them our medicine cabinet, and so many times, we forget what's in there, and that's someplace that if someone's visiting or someone particularly is looking for pain medications, maybe they're addicted, that it's our responsibility when we have something like that to store it where no one else can get those prescription drugs.
You're exactly right. I have an acquaintance who under this very thing happened, had them stored where any of us would store them, and a relative was in the home, took them, and then had a very serious overdose, and the guilt that she faced because she thought, if I would have only had them where someone couldn't get to them. And no one wants to be in that situation where they feel that responsibility. So this is a great event where people can bring them, dispose of them properly if they need to. But it's also going to be a great family event as well.
It is. And we're excited about that. We want to make sure that our community is a healthy community. And so we have organizations there, helping organizations that have resource, that if our community is in need, that they will know where to access those resources. At some time in our lives, everybody needs help.
Exactly.
And we want our community to know where they can get help and how to, just how to access it. We shouldn't be so concerned with the stigma attached to it.
Right.
For example, addiction, there's such a stigma attached to it when people go to, they're afraid because of the stigma to ask for help. And we've got to remove the stigma for asking for help when we need it.
You're right. Because we have so many wonderful agencies and organizations in our community. You and I were discussing this earlier, who want to help people. We all have things we struggle with. We all need help. And certainly we have counselors people can go to at little or no charge to them. I know United Way helps provide resources along those lines. And that's what we're here for. We all need one another all the time, and so we're so very thankful to help sponsor this project, and thankful for people like you who are stepping forward to help as well. And we understand you need some volunteers too.
Yes,
for Saturday.
Yes, we do. We are going to have free food. We're having hot dogs and chips and cookies and pop and water. So we need people that will help us to man those stations where we're giving the food away, so that they can help us distribute the food. And
like bouncy house for the kids. You have activities
now,
for children.
I think yes, we do have activities for children, and one of them in particular, we're having. Well, of course, the park has lots of wonderful things
and that's
in
at
it.
10th and Chestnut, right? Champion Park.
Yes, Champion Park at 10th and Chestnut, and we just want to provide a safe environment, so as many volunteers as we can get to help us with that, we would certainly appreciate it.
And I think the number, if you want to help volunteer or you want to help sponsor, you can call 580-541-5521 if you would like to help volunteer or just want more information about this event. You can certainly do that. It's Picnic for Progress this Saturday, May 16th from 11 to 2. Along this line, there is another project that funds being raised from the sponsors is helping, and that's something that can really help those who have taken a drug overdose. This is something new, and Gail, I'd like for you to address that as well.
We are purchasing through the sponsorship of the event. We meaning Prevention Works. I can't tell you, Prevention Works is just such a wonderful drug and alcohol resource. They are actually going to be in charge of the naloxone kits if anyone should need them. And I'll explain for anyone that doesn't know what naloxone is. It's an opioid inhibitor. Any medication that has an opioid in it, and also the illegal drug heroin, can it can inhibit the. Whenever you have an overdose, your body shuts down and you stop breathing. And the naloxone that we have, there are various forms of naloxone. If an EMT were to use it, they would probably use an IV to disseminate that into the body. But the kits that we have are a nasal kit, and they're really easy to use. All of our first responders have been trained on this. The Enid Police, I'm so excited. They are going to be carrying that.
Yes, and so we're helping purchase some of those kits. I think through this event, we've already purchased, I think, maybe 25 or 26. But to get those in the hands of families maybe who know that there might be a problem, and if these are administered, if the nasal sprays are administered, it can actually stop the effects or inhibit the effects of this. And there have already been lives saved in Oklahoma through this. And I want to commend you for the great work you're doing. And you have a saying, and there are going to be some balloons given out, and your saying is
sharpen each other. That comes from when my son passed away. He had a wristband on, and it just simply said Proverbs 27:17. I did not know what that verse said, and I asked a chaplain to tell me, and it's, as iron sharpens iron, so one man sharpens another. And so we have adopted sharpen each other as our motto, and that's what we do as a community. We can sharpen each other. If we simply each day try to make a positive difference in somebody else's life, then we'll have a better community. And I think that's our goal for Picnic for Progress.
I think that's wonderful. Gail, thank you so much. It's been a pleasure. And we hope to see everyone Saturday at Champion Park, 10th and Chestnut, from 11 to 2 for the Picnic for Progress. And thank you so much. And again, if you want to volunteer or need more information, please call the number on the screen. Thank you.
Hello, my name is Don Eck. I'm the commander of the local DAV, Northwest Oklahoma Chapter 66, located at 202 West Walnut here in Enid. I'm going to take some time out of your evening to go over some issues that are affecting our veterans at this time with the health care, and also kind of give you a rundown of what the DAV's been up to for the last couple months and what we can do for veterans and their families. On the local front, this chapter was involved in the local home show that was put on in April of this year, and we had an information booth out there, met a lot of veterans out there, had a great time, talked with a lot in reference to the issues they're having with their health care, which is a big part of our legislature move, as you will notice later on. We also spoke to them about issues they were having with getting the claims done and with the VA system in the Enid area, also with Oklahoma City. So it was a very informative deal with them, and we enjoyed meeting all of them out there. The Veterans Assistance, in reference to our claim process, is being done on Tuesdays through Thursdays. We try to be there between 9 and 1. Most of the time we're around 9 o'clock, but we get there, we stay there till 3 o'clock in the afternoon. So if you're interested or need to get a claim, all you'll need, if a veteran, is your DD-214, an ID, and if you don't have your DD-214, we can still do it with your ID. Just come in and talk with us. There's a lot of changes, a lot of benefit changes lately since March. So come in and see us. They've reacted to some of the claims that they denied before. So come in and see us, and we'll help you out through the paperwork. We also fill out claims for disaster relief. We help with getting the healthcare card with Oklahoma City VA system. We also assist in with you helping out and finding out information in reference to the loan system, VA loan process. So come in and see us. Like I said, we're there from about 9 o'clock till at least 1, and usually later. You can also call us and make an appointment at 580-242-3808. Glad to see you. This year, our chapter was lucky enough to receive some local grants, and we were able to put those towards a new scholarship program for seniors that are graduating this year. We have a new application that we have. We also have access to the Oklahoma DJ Davis scholarship and the Oklahoma Veterans Council scholarships. We have copies of those in the office. So if you have a senior or even somebody going to college at this time, come see us, and we'll see if you qualify, and we'll try to get you going through the process and help you through that. Disaster relief. We always hate bringing up disasters, but Oklahoma's time of the season appears that every time we turn around, something's happened. And this past week down in the Bridge Creek area, also with the Chickasha area, they had some tornado damage. The DAV was down there, active with the Red Cross. We served 70 veterans in the amount of $103,000 awarded out. So we do try to help out the veterans as much as possible. We do try to get that relief out there. We have a very good system that we kind of fine-tuned after the Moore tornado a couple years ago, and we have a model that we go by. So if you need some help in that area, come by and see us. Moving on to the items that really affect every veteran as we go through life with Congress. Congress is looking at changing the military's retirement plan. The House Defense is backing a plan to overhaul the military retirement plan. It's to blend a 401k style retirement system, and suggested in January there's a landmark study. There's also other changes in here. The best thing we can do is be aware of what's going on over there. The way we do that is you can check with our local website at northwestoklahomadAV.org. Also check with the state DAV website, which is okdav.org. The national website for the DAV is dav.org. And it'd be a correction on the Northwest Oklahoma. It's nwokdav.org. We also, a good reference to keep in mind of areas to check is the military.com. They're very up on the items that do affect the veterans in their everyday lives and their families. They also have come across a new bill that they're looking at trying to provide the surviving spouses with the GI Bill that the veteran had applied for. There's a new out in May of 2013. They've started this. They are now just starting to look at it. Our advice is to contact your local officials and voice your opinion on that. It would be a nice little program it would pay for the schooling for the surviving spouse, the books, everything connected to that. So it would really help with that. The events coming up for the DAV, we have May 25th up at Memorial Day. It's at Woodring Airport. It's at 10 a.m. We'll be assisting out there with that. We'd like to see everybody come out to that. It's a beautiful sight with a wall of honor out there. The co-sponsors of that is the Blue Star Moms and the Yes We Can Civitan Club. They're always out there helping out, and they do have noon hamburgers and hot dogs, so it's a pretty nice little area. May 23rd, there is a annual Red Dirt Run for Honor, 5K out there in Wood Ring, excuse me. And it's on a Saturday the 23rd, it starts at 7 a.m. and you can contact them out there for registrations. There's a lot of questions on what the DAV does, and we'd like to clarify some of that. The DAV was established to help veterans have a voice with Congress and legislature in Washington, D.C. Our main objective is to help veterans and their families achieve the benefits, the health benefits, the dependent benefits, all that for the veterans. We do complete filing of VA forms for the veterans. We train yearly. Matter of fact, in June of this year, we have got manufacturing of the conference this year that we will be doing more training and advanced training in reference to healthcare. As I had mentioned before, in March, the VA has changed the healthcare or the filing for healthcare benefits, VA benefits, The problem with that is that it has really hampered us in being the ability to, or the veteran to receive his benefits. The American Legion and the DAV has actually started a suit against the VA in reference to that. At one time, the VA would allow, if a veteran wanted to file a claim, he could start his initial claim by writing in on a piece of paper, send it into the VA, and that, from that time on, he had a year to file his claim. With the new forms and everything, they are making the veteran doesn't have the opportunity to fill it out just with a piece of paper. They have to fill out a certain form. If they don't fill it out with the form, it's kicked back out of the system. So it's really hampered the veteran and the families of being able to know exactly what forms. And if you've ever attempted to fill out any of the forms on the VA, it's very confusing with the e-benefits, all that. You know, it's just an ongoing problem that they have. The VA does have problems. They are addressing them. They are addressing them very slowly. The DAV, the other veterans organizations, are very active up in Washington, D.C., trying to best honor and respect the veterans and their families, and to represent them in the best way they can. So my answer to most people when they ask what we do, we help veterans. We help their families. We have programs at the chapter where we've started with the post-traumatic stress counseling. We do that once a month. We try to get together as a group and talk over the issues that we're having. A lot of times a veteran understands a veteran. Doesn't matter if he was in World War I or Afghanistan. War is war, and a veteran understands the war. They understand the little things that it's hard to sit down and explain to a civilian. So just give us a chance, come by and see us. Again, we're located at 202 West Walnut, and check us out on our website and check us out on Facebook. Appreciate your time and have a good day.
Good morning, we're here on Community Talk. My name's Jesse Dersham, and this is...
I'm Jeremy Dersham, and this is, can you say your name?
My son.
Jase Miles Dersham, and we are here today to talk to you a little bit about the Race for Jase. The third annual Race for Jase is coming up on Saturday, June 6th, here in Enid, Oklahoma at Crossland Park. And we just wanted to stop by and talk to you a little bit about what the Race for Jase is, what it's all about, and why we started it. And if you see any of these flyers around town or posters, you'll know what they're all about. So this is Jase, our son. And Jase, how old are you?
Good.
You're 4? Do you remember your birthday when you were born?
This.
You're born on August 18th, 2010, right here in what town do we live? Enid, Oklahoma. And right after Jase was born, I started breastfeeding, and he became really sick. And Jase, what is it that you have? Galactosemia. Jase became very ill with jaundice and had a really low birth weight. And finally, when he was 6 days old, he was diagnosed with galactosemia through a newborn screening test. Jeremy, can you tell us a little bit about the newborn screening test?
No, you can put me on the spot. Whenever we got it back 6 days after he was born on his newborn screening, something they do statewide. It came back that he had galactosemia. He was super sick. We ended up going to the hospital for we were in the 2 weeks grand total. So, and he was just super ill. No milk products, along with a variety of other things he can't have. And I'll let you go ahead and tell what
That's right.
those are.
So what galactosemia is basically Jase was born with a mutated 9th chromosome, which produces an enzyme in your liver that breaks down the sugars lactose and galactose. and he cannot break those down. So all the lactose that he was receiving through my breast milk was actually toxic to his body. And as humans, we actually produce galactose on a daily basis. And so any that Jase's body produces is toxic, and it kind of floats around in his body and causes different disorders, causes different delays. And what's the major delay that Jase is facing?
His speech is the main one we're dealing with right now, along with the diet, but speech being number one.
And Jase has speech apraxia. When he was 13 months old, we started speech therapy, not because he had any issues, but because we were told about... Yeah, you do like fruit snacks.
We'll get them later.
We were told that about 75% of children with galactosemia actually face a speech disorder. And so, Jase, who do you see for speech? What are your speech teachers' names? Who? Yeah, who do you see for speech?
Daddy.
Kathy, and who else? Vicky. So Jase goes to Prairie View Elementary School. What grade are you in?
B-Day.
Pre-K. And there he sees a speech teacher 2 days a week, and then he goes to private speech therapy here in Enid 3 days a week. So he gets speech 5 days a week, and even with that, he's about at, I would say, a 2-year-old's level for speech, and he's 4.5. So it's something that is probably Jase's biggest obstacle to overcome with galactosemia, but many other children, along with speech disorders, can have mental disorders. Girls with galactosemia face premature ovarian insufficiency. So we're really lucky that his speech is his biggest obstacle. What are you doing this summer? Where are you going to go? No, are you going to go to a speech camp?
Yes.
Yeah, so Jase got selected to go to a speech camp. Jeremy, do you want to tell us a little bit about it?
He got selected. He was one of 10 to go to Spokane, Washington for a really intense 2-week speech camp. There'll be 10 other kids. There'll be a few others with galactosemia that we know of. So we'll see some people that we'd seen through the foundation. But we've got that coming up June 13th.
Mm-hmm.
So
we're really excited to go to this speech camp. Graduate students at Washington State University work one-on-one with kids with speech apraxia. It's called Camp Can Do, and through this camp they'll do intensive 4 to 8 hours a day of speech therapy. We'll get all of it videotaped, and so hopefully we can bring it back and find some new techniques to use that are working, some innovative ways that they're working with young kids for speech apraxia. And like Jay said, there's one other student that's going that has galactosemia, so we're really excited to be able to talk with a family and interact with them, because galactosemia is so rare. There's only 4 kids in Oklahoma with galactosemia and only 4,000 in the world. So it's really hard to contact other families other than Facebook. We really don't get to be around other families with kids with galactosemia. Some other difficulties that Jase has is he's kind of on a growth delay. Last time we had his bone structure tested when he was 3, it was an 18-month-old's bone structure. So he'll probably grow a little bit longer than the average child or adult or male usually does, but he'll catch up. It'll just take him a little bit. In school, Jase is a really sensitive, caring little boy, and sometimes he faces difficulties really being independent and working on his own. So we're working with all those things, and his school's been really helpful with that. So we started the Race for Jase back in 2013 because there is a doctor in Utah who is trying to create a drug for galactosemia. Jeremy, what's this drug or medication? What will it mean for Jase?
the doctor's Dr. Lai, and he is trying to come up with a medication that will stop the production of galactosemia or galactose in the body galactose all the way around, and help with the Gal-1P. And he's several years from being done, but the more we can raise and put forward to it, the quicker he gets through.
So right now there's no treatment, no medication, no cure for galactosemia because it's such a rare disease, and there's very little research being done. It's hard to get a grant from the National Institute of Health because it's such a small community of people who have this rare disease. So it's up to individuals, people, families whose children are facing this disease to raise all the money. And this doctor in Utah, he's working on this drug, and it'll stop Jase's body from producing galactose, which like I said, it's harming him every day when his body produces this sugar. So we're hoping that in the next 5 years that drug will be available. And if Jase only has to go 9 years with his body hurting itself, then the rest of his life will be so much better, and he'll have such a brighter future if he doesn't have to go the first 40 years of his life with his body harming itself. And all of the galactose that is in his body, it just builds up, and it can cause different challenges throughout his body. So all the money from Race for Jase, 100% of it goes to research for galactosemia and research for this drug. We're so fortunate that people in Enid have stepped up and donated to this cause, or even just signed up to race. It's a 5K run and a 1 mile walk or a 1 mile fun run for kids. And the first year we did it, we raised $8,000. Last year we raised over $10,000, and this year already we've raised about $5,000. It's going till June 6th, so we have 2 or 3 weeks left to hopefully make up and raise another $5,000. If you want to sign up for the Race for Jase, how do you do that, Jeremy?
You can go to Get Me Registered, or you can stop by Ironworks Gym, or you can just, they can catch one of us. Our numbers on the posters, so give us a call.
That's right. So to sign up, you can go to www.getmeregistered.com and you search for Race for Jase with a 4, the number 4. You can stop by Ironworks Fitness and Tanning. It's at 1602 North Van Buren, and sign up there through a paper sign up. You can follow us on Facebook at Race for Jase, and we have updates there on it, and we're always telling you what's the latest going on with Jase. We update it when we go to the doctors, and we update it when we find new things about galactosemia. They're always changing the diet guide, so all the time we're getting to introduce new foods to Jase, and sometimes having to restrict foods that he's had before. So Jase, whenever somebody gives you some food, what do you ask them if it has in it? Milk. You say no milk, right? And Jase has been so good about that. He goes to a normal pre-K, and when he started, we were terrified because I'm pretty sure the child next to him in their lunchbox, they probably have goldfish, cheese, yogurt, something that Jase can't have, and it's terrifying thinking that 4-year-olds would share food because that would be so damaging to Jase's body. And luckily, we've had the best teacher and the best school. We've been so fortunate that he goes to Prairie View, and everybody knows Jase. They know that he has galactosemia, what he can't have, and that Jase can only have what's in his lunchbox. Jase, what's your favorite thing about school? What's your favorite thing about school?
Pudding.
The pudding in your lunch? Your dairy-free pudding? What else do you like about school?
Oh no.
Do you like going on the playground?
Yeah.
Yeah? Yeah. What else do you like?
Daddy.
The slide?
Daddy, go.
Going down the slide?
Yeah, Daddy, go.
Yeah.
Daddy, go.
And riding on it?
No,
Yeah.
Daddy, go.
Okay.
Daddy, go.
Riding in Daddy's car?
Yes.
Oh, you like riding in Daddy's car? Okay. Okay. Well, we want to thank you guys so much for having us here, and thank you for watching Community Talk.